Joining us today, we have the Honourable Stephen McNeil, Premier of the Province of Nova Scotia, and Dr. Robert Strang, the Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina. Thank all of you for joining us today. Dr. Strang will give us an update on where Nova Scotia stands with COVID-19.
Thank you, Premier. So today we're announcing another 13 new cases of COVID-19, bringing the total number in Nova Scotia of confirmed cases to 41. And I'll remind folks, as we said yesterday, we can now say confirmed cases because we do not have to send labs for confirmation to the national lab, and we don't have to talk about presumptive cases. Like the other cases, these cases are travel related or related to close or from close contact with earlier known cases. Several of these new cases there's connections, so they're within household contacts and exposures that the family had traveled together outside of Nova Scotia and now back home. One of the cases is a youth, so the age range for these 41 cases is now from under 10 to the mid-70s. We have cases across the province, and we have one individual who's in hospital. Everybody else is recovering and remaining at home. It's important to understand that what we're seeing is actually travel-related cases. At this point, we are not seeing any cases related to community spread, and we are actively looking for community spread. To me, that's an indication of success. We have asked people when they return to Nova Scotia to self-isolate and limit their exposure to others. And what we're seeing when public health, we follow up with each of our cases, we're seeing very small numbers of close contacts, mostly household contacts. So people are doing what we're asking them to do. And when they get sick, they're calling 811, getting in for assessment, and then going home and self-isolated. The system is working. People are asking them what we do, and the system is working. And what that's doing, that while we're getting cases, we're limiting the ability of this virus to spread throughout Nova Scotia. That's critically important for people to understand that what we have in place, if we all do it, will work. What we're asking people to do, as we said yesterday, all of us practicing our hand washing, our personal protective measures, all of us working on social distancing or where necessary self-isolation, keeping ourselves apart. It can and it will work if we do it all together. And it's really important that we understand that message. Just a reminder for people from yesterday, with yesterday's announcement that starting today, anyone entering the province of Nova Scotia must now self-isolate for 14 days. This means going straight home. Do not stop at the grocery store, go to the office, or visit family and friends. If you need groceries, other essentials, make arrangements with family or friends to help you out with that. And once you start self-isolating at home, it's important that you can spend time, stay close to home. If you have a yard or a balcony, you can go there, but please do not go any further. I understand that this is difficult for people living in multi-unit dwellings, and this is very challenging. We ask those individuals and their neighbors to work together to be creative. How do we, if we know somebody if I'm in an apartment, somebody who's in self-isolation, rather than being critical of them if they try to go out, how do we help them so that they can stay in? And people who are in self-isolation, this is a time you need to reach out and ask for help. Again, as I said yesterday, it's my 3 C's. Caring for each other, a sense of community and compassion, and then common sense. So maybe I got 4 C's now. As a reminder, and the last thing I'm going to say is if you have traveled or you've been in contact with somebody who themselves has traveled and you're starting to feel unwell, go to the 811 online questionnaire. That'll give you further direction about whether you should be then calling 811 and getting in for testing.
Thank you, Dr. Strange. And we are at a state of emergency today, and we have tightened our borders up. At the Nova Scotia and Brunswick border, it was a slow process today, and we had a number of workers caught in lineups. This will smooth out. We are creating an essential service line that will make it faster for those who need to get across. Healthcare workers, those who work in financial institutions, manufacturing of essential goods, construction, and truckers supporting trades. Use common sense. If you are not an essential service worker, you should not be crossing the border. You should stay home. We have stopped social gatherings of more than 5 people. Our beaches and parks are shut down, and I want to thank Nova Scotians for following this emergency order. I know this is tough, but we don't have a choice. This is serious business, and I can't say that enough. You can still get your groceries, go to the pharmacy, go for a walk around your neighborhood, but do not travel in groups. We will now try to answer any of the questions that we can here today, and if we can't answer them today, or if more clarification is required, we will post it online.
We'll now go to the phone lines for questions. Again, we will take one question and one follow-up. We have about 25 minutes. There are 17 of you on the line, so we will not have time to go to all your questions today. We'll start with Shayna Luck from CBC. Go ahead, Shayna.
Hello. Our reporter at the border is telling us, although people are being given information there's no tracking happening. How can you enforce the state of emergency if there's no way for police to tell who should be self-isolating and who shouldn't?
Well, everybody coming into our province should be self-isolating. That's the point of being at the border. If you're coming home, we expect you to go directly home and self-isolate. There are those who are coming in who are healthcare workers, for example, work at Amherst, who live in New Brunswick. We have some manufacturing that's happening. Those workers will be in and then are to return home tonight.
Do you have a follow-up question, Shayna?
Yes, there are thousands of Nova Scotians who are out of work as a result of the closures, and there are thousands of business owners in the same boat. I'm wondering, what should they expect from your government to try to make up for their losses, both personally and professionally?
Well, as you know, the national government has laid out a substantial financial package to support those businesses, to support individuals. We have been strongly encouraging the national government to have support, deferred payments on commercial loans, especially for those who have those loans that'll pass that on to restaurants and bars that are renting from them. We need those deferred payments if our economy is actually going to recover coming out of this. That's the most critical component for us. We've seen provincially, Minister McClellan laid out a number of initiatives. There's a $500,000 line of credit. We as a province will secure 100% of the first 100,000, working with other entities to see if there's ways that they can do split shifts, work in the same way to meet the protocols of public health. And we will continue to do that and work with our partners who are providing services, essential services to citizens. But let's be clear, all of us, both public and private, are going to feel the pain of this. This is something that none of us have seen before. Dr. Strang has talked about the length of time, could be 6 to 8 weeks. We need to make sure that we can find our way through this with good public policy, but it will be painful for all of us.
Next, we'll go to Keith Doucette from the Canadian Press. Go ahead, Keith.
Yes, a question for the Premier. I understand that you will be on a conference call tonight with the other premiers and the Prime Minister. What will be Nova Scotia's ask of the Prime Minister at this time?
Well, we're continuing to work to make sure that they provide support, particularly to the commercial side of the businesses now, to make sure that we can keep those entities functioning and defer payments with the banks, the national banks. But we also wanted to make sure that as Canada retools itself to begin to make many necessary health equipment, that they know Nova Scotia companies are able to be part of that. You would know Stanfields and Truro, Michelin have all stepped up. We've heard from a number of our distilleries that are working to convert into making hand sanitizer. BioVector that's in Windsor is working towards providing some support around treatment for not only this, but other medicines. So we wanted to make sure that they recognize the amount of capability that Nova Scotia has to help the national government, which what they describe as this war effort to ensure that we prepare Canada for dealing with COVID-19.
Do you have a follow-up question, Keith?
Yes, it's for Dr. Strang. It's on behalf of a colleague. What is being done to increase access to telemedicine as people are seeing their operations and other regular appointments canceled? And is there any chance, maybe the Premier can answer this, that My Health could be extended? I know that there was an announcement weeks ago concerning that.
So I'm not directly involved in those conversations, but we are rapidly expanding access and options for telehealth. That's certainly been identified as a priority conversations between with the Minister of Health, Department of Health and Wellness, and Doctors Nova Scotia. Removing some of the barriers it's been a priority to move ahead for a while, but we're now moving rapidly on that. Well, if you have more detailed questions, we can get back to you later on we can get us more information from Health and Wellness.
And Keith, early on when Minister Delory was here, we have changed the fee code now where we will fund physicians who are working remotely, whether they're using the phone or video conferencing with patients. There's a new program out that will allow them to contact you directly and you just link into that video. We are funding that through our pay codes now. At the same time, the My Health network that left, it really didn't just leave Nova Scotia, left Canada. They were, that option isn't there, but we're looking at all kinds of options, whatever's available to be able to connect healthcare providers with their patients.
Thanks, Keith, for that question. Next, we'll go to Natasha Pace from CTV. Go ahead, Natasha.
Hi, I guess this would be for Dr. Strang. I understand one of the newest cases reported today involves a child under 10. I'm wondering if you can expand on that a little bit, if you can give us a better age range, how the child's doing, if that raises a level of concern in Nova Scotia for doctors.
So I'm not going to go any further than just an under 10. We're very careful about we don't disclose private information. All cases, including this child except one, are recovering well and at home. We do know in general that, especially looking around the world with COVID-19, that children can certainly get sick, but they are at the lowest risk for getting severe illness. So we're certainly hoping that that this child continues to recover well. But our colleagues at the IWK, they're working very closely with the Nova Scotia Health Authority and the department around our COVID-19 response. They have a lot of expertise at the hospital to deal with children if they do become more significantly ill with this virus.
Do you have a follow-up, Natasha?
I do. I'm wondering how you're doing with getting additional medical supplies, including the masks. Are there any more coming into Nova Scotia? I believe the other day, Dr. Strang had mentioned they were reaching out to different organizations, such as construction companies, to see if they had any additional masks they weren't using. How's that going?
That work is actively underway, both in terms of working with the federal government around a common procurement process for masks. We're actively reaching out to a range of businesses who have quite frankly come forward to us, to government, to offer their help. We're also working in other parts of government, for instance, our school system, where there may be supplies of masks and gloves. So we're actively looking everywhere we can to bring that in to supplement the supplies that we have in the health system. We have adequate supplies now, but we know that we need to build that supply because we're in this for a number of weeks, and there's lots of ways we're doing that within the province and also at a national level.
Thank you, Natasha. Next, we'll go to Cassandra Nadeau-Lamarche from Radio-Canada. Go ahead.
This is a question for Dr. Strang. When do you suspect that Nova Scotia is going to have fully recovered cases, and what will those people need to do at this point? Will they have to stay home, or?
Yeah, so I mean, typically the course for this disease is people tend to recover within about the 10-day mark. So we may have some people, our initial cases, getting close there. I'm not going to guess on any individual cases. What we have talked about at a national level, we now know that if somebody has been sick, if they're feeling well, 10 days after the onset of their symptoms, so maybe day 8, day 9, they no longer have any fever and they're feeling well. By day 10, we can say that you're no longer have to be under isolation. They are no longer infectious, so they don't have any more restrictions on what they can do because they're not able to pass the virus on anymore. And also they've now been infected, so they have immunity, so they're not going to get infected again. If they're sick beyond that 10-day period, we'll continue to work with them. Public health and works with them on a daily basis, as well as the clinicians. And beyond day 10, once they become, their fever stops, their acute symptoms are resolved, then we consider that they have recovered, and then they can go about their daily lives like the rest of us, still adhering to the general social distancing.
Do you have a follow-up, Cassandra?
Yeah, so we saw a big jump in cases today. So what is this attributable to? Is this because we have more testing done now, or?
So I think, as I said earlier, I think this is actually while we don't want to have cases at all if possible, but that's not. We're in a global pandemic. We are going to get cases. The increase in cases over the weekend and today, when I look at the cases, they're all travel related or people who have been in close contact in a household with somebody who has traveled. And also we know that when we look at when public health does the follow-up, when I looked at it today and I just showed the Premier, most of the cases have one or two close contacts identified. That tells me it's working. So what we put in place, anticipating cases coming from people who have traveled, is working. So people are self-isolating. When they're becoming sick, they are getting in and getting tested through the appropriate measures, and they're continuing to isolate themselves while they're sick at home. So we are, and by having the limited number of contacts, means that we're minimizing the chance of that ill individual spreading it in Nova Scotia. So yes, we have more numbers, but we fully expected we'd get more numbers as more people return from traveling, and the things we put in place to protect Nova Scotia are working.
Next, we'll go to Chris Halef from News 95.7.
Thank you. A question for the Premier. Our newsroom received a few messages from people who say they're still working, but the companies that they're working for aren't complying with social distancing rules. One person said management has offered no guidance or directives, so employees simply aren't complying. I'm just wondering if you could comment on that and perhaps the need for employers to take responsibility here by keeping their employees safe.
Every operation is required to follow Dr. Strang's order of self-distance 6 feet or 2 meters between each employee. Those orders are not negotiable, quite frankly. They need to continue to make sure. If there's an essential service component, then working through Dr. Strang's office, there may be certain times when that is acceptable. But employers need to work with their employees. It's incumbent on employers to ensure that you keep your workforce healthy. If that means you change the way you've done business, double shifting, reducing half coming in the morning and half coming in the afternoon, you need to take the appropriate steps, and it is the owner, and the onus is on the owner to ensure that they are providing the appropriate workplace for their employees that meet the health standards.
Do you have a follow-up, Chris?
I do, yes. We've also heard from some people who said they're being told to come into work, but they aren't comfortable doing so due to the outbreak. One person said they don't want to go in, but they fear repercussions or punishment if they don't. I was just wondering if you could speak to that and whether the province may potentially impose measures to address that issue, especially in a situation where somebody may be working under conditions that requires interaction with people.
So first of all, our experience has been the vast majority of employers in our province are working with their employees to provide the appropriate work environment that meets the guidelines and the standards that Dr. Strang has put out. I think employers need to be mindful of that. If an employee is feeling that this is not the appropriate place for them, they have to work with that employee to find a suitable solution. I think employees need to also be cooperating with an employer if they're changing shifts and how they can make that employee and feel more comfortable in that workplace. But all of it has to fall within the standard of Dr. Strang's order of the 6 feet and keeping your distance, proper hygiene, making sure you're cleaning the workplace, all of those things. We're hearing very creative ways that employers are able to keep their employees going, keeping activity, and we'll continue to work with them. But I don't think anyone should dismiss the feelings of any, whether it's the employee or the employer, quite honestly, about how we're dealing with this. This is a frightening virus. It is, we've seen what's happening globally. So the feelings that people are having are real, and all of us need to spend a lot of time listening to what each of us are telling each other and finding the proper solutions for them.
Thanks, Chris. Next, we'll go to Jesse Thomas from Global. Go ahead, Jesse.
Thank you very much. Dr. Strang, you said we're not seeing any community cases spread, and that's an indication of the success that these measures are working. I guess, how do we know that? What is the science that's backing this up and showing there are no community-transmitted cases?
So, as I said yesterday, we are looking at that in a couple of ways. We have continued, we're still in our influenza season, and we have a couple of measures of influenza surveillance, which would also be triggers where we might need to go in and do COVID-19 testing. So, for instance, we are now getting reports every day. All of our hospitals, the infection control practitioners report into my epidemiology team on the percentage of people coming through the emergency room who present with flu-like symptoms, and we have a definition for that: fever, cough, and some other things. So that's reported every day, and we're looking at that every day. And if we saw that number jump up, which it hasn't, but if we did, we would go in right away and say there's something going on in that community. More people are going in the emergency room with respiratory symptoms, and we'd start actively testing. If we have an outbreak of respiratory illness in a long-term care facility or another group setting, we would now be moving in quickly, along with testing for flu and other things that we always do. We would be testing for COVID-19. We are also now starting to move. So I've talked before about how public health, we follow up all our cases and identify those close contacts. And up until now, we've been saying if the contacts become unwell, then we'll test them. We're going to start actively testing the contacts of our cases right away, and we'll be working on the backlog of the cases that we've had up till now to do that as well. That will start to give us an indication of is there spread to people who are maybe in close contact but maybe asymptomatic as well. And we're looking at ways we can do other places in the community where, as part of regular care, we start also testing people who have fever and cough even if they haven't traveled. So we're rapidly looking at those ways, always doing things that we know is within the lab capacity we have, and we're ramping up our capacity in the lab to do testing as well.
Jesse, do you have a follow-up?
I appreciate that. I understand. Are we going to get a clarification from you, Premier, or Dr. Strang, just on these recommendations around closing parks and trails? I think there's a lot of I guess we're looking for a clearer explanation on what people can and can't do, because there's so much misinformation swirling around with people on social media.
Listen, I have said if you have to drive to get your exercise, you're going too far. What we need you to do is walk for exercise, not to socialize, and you can do that in your community. If you live near a trail, go on the trail. But if you're driving to go to the parking lot, stay in your own community. Walk the block, walk around your house, walk along the side of the road that you live on. But what we're asking people is not to drive to public spaces. It's tough enough to be able to control the volume of people there. When you add into that you allowed motor vehicle traffic to go to the parking lot, it just compounds, and we get what we had this weekend, where we had traffic jams, where we had hundreds of people gathering in places. That defeats the purpose of what Dr. Strang has been talking about keeping people safe. We're asking people to self-isolate in their own home, and for the exercise, do that in your community. This is a 2-week period where we're asking you to put the health of your neighbor and your province at the forefront. As you go out and get your physical activity, you can do that by walking in the same community that you're in. If there happens to be a trail there, walk on that trail, but do not drive to it, please.
Next, we'll go to Lindsay Armstrong from all Nova Scotia. Go ahead, Lindsay.
Hi there. I wanted to know a little bit more about what the ramping up of testing has looked like. Friday, Dr. Strang said he was hoping to jump up to 400 to 500 tests. Looks like the past few days we're still hovering somewhere around 200, 280 tests a day. What is needed to increase that testing capacity to be around the 400, 500 level? Is it supplies? Is it manpower?
So when I have had ongoing conversations with my colleagues at the lab, and they're just adjusting their staffing model. I think within the next day or two, I will be hearing from them saying that they're well established in going up to that minimum of about 400 a day. We are still, even at 200 a day, that's within the capacity of the number of tests we're getting, and we're very close to getting doubling that in the lab.
Do you have a follow-up, Lindsay?
Yes, I do. At what point do we expect to be able to test people who may have symptoms but have not traveled?
So that's my answer previously. We're doing that in a couple of ways now. We're testing all of our contacts of cases. They may well not have traveled. They've been exposed to a known case. So that's a start of how those are at the greatest risk of having COVID-19. And frankly, the testing our contacts, they're the ones who are the ones that are most likely to get sick and be perhaps spreading it out into the community. And as I said, also we're working with the colleagues in primary care and emergency departments about, as part of regular care, when people present with symptoms of cough or fever and they haven't traveled, building that in for testing. We just need to be careful how we do that, that we don't have everybody flooding in and overloading our family doctors or our emergency rooms just because they want to look for a COVID-19 test. So we need to do this thoughtfully.
We have about 5 minutes left for questions. Next, we'll go to Sharon Montgomery from the Cape Breton Post. Go ahead, Sharon.
Oh, thank you very much. First of all, I just wanted to pass on, I'm hearing a lot of gratitude from the community that you do hold these updates in a manner that they can listen in. So I just wanted to pass that on. And this for Dr. Strang. I think people do understand the importance of not identifying where people affected by this virus live, but I'm constantly inundated with messages, people wondering how prominent it is on Cape Breton Island. And I'm wondering if there's anything at all you can share.
So I'm careful about picking one part of the province aside from another. We need to be prepared as a province. We will, if it's not there yet in your community, we need to all be preparing together, taking the measures that we're asking about, that we've talked about repeatedly over the last week or more, everywhere across the province, because if it's not there now, it will be coming. So I don't want to give some people false reassurance that that maybe they're not at risk because by comparing to another part of the province. So I would ask everybody in communities across the province to do everything we're doing, to do everything you can to help each other out. We all have to, will be affected by COVID-19 from Yarmouth all the way up to Sydney, and we all have to work together.
Sharon, do you have a follow-up question?
Dr. Strang, with another reporter, had just asked that. However, is there a number that of people who do fit the criteria to be tested, an approximate number of those people who do call per day?
I don't have numbers in front of me in terms of our call volume to 811. What I can tell you is that since we started the testing, we have tested just over 2,300 people in less than 2 weeks. So those are all people who have appropriately screened in through the 811 and then gone on to be tested.
Thanks, Sharon. We'll take our last question for today from Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Hi, thank you. Dr. Strang, I'm wondering about timelines. You've said all along 6 to 8 weeks is the critical period, which I read as late April into early May, perhaps midway. The Premier just said the restrictions on parks is a 2-week process. can you give an indication to people how long this is going to take, how long these restrictions will be in place? Because if they're successful, and you say they are, won't it be the case that they'll have to extend past the 8-week point?
Very well, Tim. I just clarify the order that we have in place is a 2-week order that will need to be renewed in 2 weeks, and we'll notify Nova Scotians. It's the same thing as that we've talked about public education. We're now in the first of the 2-week extended March break. We will be assessing that. All things look that will more likely be longer, but we'll base that on the evidence as we continue to work our way through this.
Tim, do you have a follow-up question?
Well, I guess I didn't hear a response to the 6 to 8 weeks. Will that be responded? But my follow-up was I heard Dr. Strang say that with some definity that people who have contracted the illness and recover have immunity. I've not seen that in the international press as a definitive statement. So could you address both of those, what happens after 8 weeks and the immunity issue?
So I think, as the Premier said, we were approaching this in the initial 2 weeks, and I meet with the Premier every day, and I bring him the epidemiology, and we'll be continuing to adapt and adjust our response as required by the epidemiology. But I'm also very much aware, and the Premier's aware, if we look across the globe, that this doesn't necessarily end in just a few weeks. Even all the things we're doing, we will get more COVID-19. We're not naive to think that we're going to prevent it, but everything we're doing will minimize it. But it still means that you have to have those restrictions, and we will adjust those restrictions on an ongoing basis as the our local epidemiology is showing us. For the issue of immunity, that all the evidence says that people develop immunity. This is a viral disease like many other viral diseases that are long experience with viral diseases, that once people are exposed, they do, by and large, unless they have underlying some specific health conditions, they do develop long-term immunity.
Strang, just a point of clarification for folks on the line. What does Dr. Strang mean by testing our contacts?
So when we have somebody that tests positive, that we're notified right away by the lab. What local public health does is that they actually go interview that individual and their family. And so essentially we sit down with the person who's infected and we say, when did you start to become ill? Where have you been? Who have you been in contact with, close contact with, since you developed symptoms? Anybody they've been in close contact with is now defined exactly that, a close contact. So we're going to start, rather than, all those close contacts are told that they need to start a 14-day self-isolation period. So one of the things we're ramping up now is, rather than waiting to see if those people become sick and then testing them, we're going to start testing them actively right away as they're identified as a close contact. Because maybe we're getting them early, we're getting more indications of asymptomatic spread. While I have the mic, if again I was remiss, I missed one of my remarks. We need to identify to people that blood services is an essential part of our health system. We do need blood. We're working with Canadian Blood Services across the country, and they're going to run their blood clinics, whether it's out in the community or for their base on Bayers Road, in a way that adheres to our public health principles of less than 5 people keeping social distancing. So I really encourage people. We still running the rest of the healthcare system. We still need blood products. It is safe for people to go and continue to give blood.
I just want to support Dr. Strang in this and make a message to Nova Scotians who are coming home. That's why it is absolutely critical that when you come into our province, you go directly home. Don't go to the grocery store. Don't go to the pharmacy. Go directly home. The fewer people you come in contact with, you will eliminate the spread of this disease. The more you move around your community, the more difficult it is for us to be able to identify everyone that you've come in contact with. And if you look globally, that is where governments and countries have had challenges of identifying and controlling this virus. So if you are entering back into our province, you must self-isolate for 14 days. It is your obligation to your fellow Nova Scotians to find yourself at home, because if you become sick, It allows us to be able to isolate that and prevents the spread of this virus. It is absolutely the #1 way that we will be able to get on top of this. I'd also like to take this time to thank the many frontline workers, those working in healthcare, doctors, nurses, pharmacists, home care workers, long-term care providers, mental health professionals, cleaners, and all the supports working in our healthcare sector. To the truckers who are transporting the goods that keep our shelves at the grocery stores, pharmacies, and gas stations stocked, we are grateful. To all of you who are remaining open to provide the essential things Nova Scotians need, thank you. And thanks as well to the financial institutions working to ensure that people have access to funds, helping to pay their bills, cash checks, or keeping seniors and others who need that support connected. To our law enforcement, firefighters, paramedics who continue to keep us safe, thank you. There are many businesses that are finding creative ways to operate safely while following public health protocols. Self-distancing, sanitizing the workplace, and employees washing their hands regularly. And to our public service, those who are in and those who are working from home, thank you for your support. You are keeping our province moving. And finally, to the families and children who are forced to stay inside, I know this is hard, but you've got this. To our seniors, many of whom are home alone and they can't see their grandchildren or get that hug, hold tight, know that you are loved, and we want to keep you safe.